A new report from the nation's top health experts examines when and how the United States can transition out of the COVID-19 pandemic era and back into pre-pandemic routines and lives. Joining us now for more on this is Dr. Howard Forman, Yale professor and Health and Veritas podcast host. Yahoo Finance senior healthcare correspondent Anjali Khemlani is here as well. Doctor, I'll start with you. How could this transition be pulled off successfully?
Look, I think we all know that we're seeing declining cases, deaths, hospitalizations. We're in a good place right now, but we can also look throughout the world and we see that in the United Kingdom right now, cases are growing once again. We're not going to be at a completely normal state. We're still seeing many, many more deaths than we would ever have accepted pre-pandemic. So we have to start to plan for the future. And the United States has underperformed in so many ways during this pandemic that we can't just keep going back to the old playbook of reaction. We have to be proactive. And what this roadmap does is it lays out some very actionable items, things that are not pie in the sky. They're not necessarily audacious. They're reasonable, actionable items that can allow us to get back to normal, but at the same time not accept the possibility of 1,000 deaths a day, or even, quite frankly, 2,000 deaths per week. We want to get back down to a level where the worst flu season is something that we might now tolerate and not something where 10 times that is what we're tolerating.
Dr. Forman, Anjali here. We just saw some of those recommendations on the screen, specifically looking at that 85% vaccination point, as well as looking at the data infrastructure. I think that has been one of the key reasons why we've seen such a struggle in the U.S. We saw how the issues that have faced the healthcare industry for some time, including sort of really slow to come into technology, has been part of the reason why it was so hard to trace in a very tech-savvy and tech-heavy world. What are part of those recommendations, would you say, moving forward that public health really needs to invest in and look at in order to avoid this the next time around?
Yeah, look, I think, the report has a lot of recommendations. And I think for an outsider who doesn't want to read the report, you'll think this is just, either right-wing or left-wing fluff. I mean, people, by the way, have criticized it from both sides. But what it really does is it says we need to attack this on every level. We can't say vaccines are enough. We can't say that antivirals are enough. We can't say that testing is enough. All of these things are necessary. And by the way, we need to invest in understanding what long COVID is and how it's going to impact our lives in the future. And we've grossly underinvested in that. And that's an opportunity for us to do something now that will pay dividends in the long run by answering questions that we really ought to have answered by now.
Dr. Forman, it's Julie here. So you and a large group of other academics, medical professionals, et cetera, have come up with this roadmap. What's next? What's the receptiveness? I mean, just from an anecdotal element, people seem very ready to move past this, while at the same time, it seems like we still have a lot to do, to your point. What are you hearing from authorities on the plan?
Right. So the nice thing was that the White House was very receptive, as well as Health and Human Services was very receptive to the input of this group. They met with us. They listened to us. We believe that some of the recommendations have already been directly incorporated into their plans, and more will be considered going forward. This is not a roadmap for the common, I don't want to say common man, but this is not a roadmap for the person who goes to work every day. This is a roadmap for government, for private industry, for state and federal government. This is how we collectively have to serve the public good. This is not, there's no masking mandates in here. This is all about how do we guide policy in the coming years, not just for this respiratory virus, but for future respiratory viruses, for future pandemics, so that we're better prepared. It's acceptable to make big mistakes one time, but if we make it over and over again, it's unacceptable. It's embarrassing for our nation that we should ever have to make those mistakes again.
I wonder about the immunity. I know you just said that vaccines alone are not important, but we did see a really interesting chart as part of the report, which looked at sort of the basic principles of immunity, which is in that the more immunity you have built up within a population, the less chance the virus has to really spread and cause severe disease. And that's something that I think is at the core of sort of what we saw unfold here in the country, as well as really globally. And so I wonder, this has been something that maybe the anti-vax community has been on for some time, is not being able to accept this, to help with this theory. So is it on the public health sort of sector to really push for different messaging on how we can achieve better protections against a future virus?
Yeah, look, one of the areas of the report and messaging from that is about misinformation and disinformation. So we address that. We also address the fact that we have to come up with more creative ways to use what we've learned about behavioral psychology and behavioral economics, for that matter, to get people to over the hump to get vaccinated for this and for future infections that may occur. I'm hoping that the divisiveness around vaccines may actually fade into the background in time, and that we may still have a chance of getting more people to, get vaccinated. We're still losing, as you know, hundreds of people every day that absolutely could have been saved if not for vaccinations. But even accepting all of that, we still have to do this on multiple levels. We have to be thinking about not just one antiviral like Paxlovid, but we have to be thinking about developing newer ones. Using multiple antivirals, as we have used with HIV, can be a very effective strategy. We need to be able to use testing in a more effective way. And as you know, even testing, the uptake of the free tests offered by the Biden administration have been low. People still do not understand the reason for testing. We need to get that out to individuals. There is a lot in that report. It really does go through line in line, detail in detail, so that individuals as well as the overall government have a better understanding of what the plan is going forward. But it's not a game plan for a family. It's a game plan for government and for private firms.
Real helpful insights here. Dr. Howard Forman, Yale professor and Health Veritas podcast host, Yahoo Finance's Anjali Kamani. Thanks so much.